senior colleagues, and other colleagues. This morning, I'll be presenting question 2 of the 2023 May National Postgraduate Medical College General Medicine recall. And question 2 reads thus. A woman came to the clinic with history of recurrent feeling of unwellness and generalized umbilicated rashes that was also seen in the inner region. Skin swab biopsy was taken for the rash and awaiting results. She had HIV test done, which has now come out positive. She's the fourth wife of her husband. She has come to the clinic today for the result of her HIV test. Her husband was sitting next to her. So the task is 1, to talk to her about the result of her test. 2, how would you inform the husband about the status of the wife? And then 3, how would you allay the anxiety of the other wives and family members? I think I'll need a volunteer for this session, please. Please, can I have anyone volunteering?
You might need 2 volunteers because the husband is sitting beside her, right?
Yes, sir. Thank you, sir.
I can volunteer, sir. Dr. Lighton.
Thank you very much, Dr. Lighton. Please, is there another person as the second volunteer next to?
Hello, is Dr. Shamsuddin in class? Hello?
Yes, I'm in the class.
Dr. Kuti, why don't you get the lady? So the lady will be the wife, and then or is Dr. Lighton a lady?
Dr. Lighton is a lady, sir. My voice is just sounding like a male.
Okay, Dr. Shamsuddin, just volunteer with Dr. Lighton, please.
Okay, thank you. Morning, ma. Okay, Dr. Lighton,
Good morning, ma. Okay.
Good morning, ma. You're welcome to clinic. My name is Dr. Ibrahim Itubi. You can call me Dr. Itubi. And
Okay,
I'm your
sir.
today. So you're welcome to clinic. Good morning.
Good morning, sir. Thank you.
How are you today, ma?
Very fine.
Please, would you like to confirm to me your name, how you'd like me to call you, your age, what you do, and your level of education?
My name is Abimbola Lighton. I'm 35 years. I am a trader.
Thank you. Please, what's your level of education?
Secondary school.
Okay. It's your preferred language for discussion, English?
Yes, I'm okay with English.
Thank you very much. Right. And I know you're in clinic today to have discussion on some symptoms you've had. You've had some symptoms and you've been coming to the hospital of recent. Is that so?
Yes, sir.
And please, what symptoms have you had?
I've not been feeling fine. Rashes on my body, just generally weak. I'm not strong. At times I even cough.
Okay, sorry about that. And during your last visit, some investigations were done and some samples were taken. And I believe that is why you're in clinic today, to know what the results is.
Yes, I was told that the result will be ready by today. That's why I came.
Okay, thank you. And to go further in this discussion, are you okay with this environment? Are you fine with us having a discussion here?
Yes, I'm fine. Is there any problem, doctor? It's
Okay,
okay.
no, I just want to be sure you're okay and then you're fine with the environment. And then I can see that you came in with somebody. I'm not sure if it's your husband or brother. Can you just confirm?
Oh, it's my husband. We came together.
Okay. You're highly welcome, sir. Welcome, sir.
Thank you. Thank you, doctor.
Mr. Lighton, I would also want to know, are you comfortable to have your husband stay around for further discussion we would have this morning?
That was why I told him to follow me, because I don't know what the outcome of the test will be. Maybe we'll need him to assist in any way.
Okay, so you need him
together at home. So you can stay.
Okay, so you need him in our discussion this morning.
Yes, no problem, sir.
Okay, thank you. Is there any other person you would like to join us?
No, myself and my husband are fine.
Okay, thank you. Like we started talking earlier, your samples were taken for some tests, and the results have started coming in. And currently, I have one of the results in my hand here, which has come from the lab.
Okay, I hope it's fine, sir.
I'm afraid I do not have good news concerning the test. From the results we obtained from the lab, it turned out that your HIV test, which was done, came out positive. Really sorry
Where did I get it from? How come?
I'm really sorry about this.
Husband, where are you now?
Sorry about this, my dear.
How come? I just can't understand. Why did this happen? How? Doctor, what are we going to do about this?
Okay, I know that this is a very heavy diagnosis.
Does it mean I'm going to die soon?
No, it doesn't mean that. Actually, with advances in science, there are now medications that people who have similar conditions take. And what they have to do is to be compliant to this antiviral medication. And with compliance, they live almost near to normal lives as they take it.
I hope the drugs are not expensive. I'm a petty trader, sir.
Yes,
and we spend so much money on this sickness.
I'm sorry about that. But the good thing about these drugs is that they are actually given free. And there's a lot of government intervention to it. So you do not necessarily have to pay for the medications. They're actually given free. But the major thing that will be needed for you is to be compliant and then to take this.
How many weeks will I need to use the drug?
Unfortunately,
or how many days?
The drug you would have to continue with for much of the rest of your life because, yes, ma'am. Because if you stop taking them at some point, you can become resistant to a particular line of the drug, which will also mean change to another group. And when you try to change to another group, that might involve doing some expensive tests, and then you might now have to pay for some of those other things. So the best way to handle this is actually to be compliant with the medication. And I can link you up with many other people who are having this. And you can see that as long as they're compliant with the medication, they are able to cope and live near normal lives, actually.
Using drug every day of my life. Hey. Oh, Lord.
I know it's a huge challenge, ma, but when you consider what can happen if you do not take the medications, it might be better to take the medications actually. Because medications are not taken, the risk of having more and more of the symptoms you've had that made you come to the hospital might even worsen, and it can affect many organs in the body and can cause further destruction. So the drugs help to limit how these organisms grow, how they affect organs, and the implications they have for systems.
Okay. Oh.
I'm so sorry about this, ma. I'm not sure if there's anything more you want to know about this.
Are the drugs many?
They are not many, ma, and they are made in such a way that you can take them at a particular fixed time of the day, and just
How
taking them.
many times a day?
They're usually taking
Morning,
one.
afternoon, night.
No, ma. They're just taking once a day, and you can fix a particular time, to take it so that you are regular and it doesn't, you don't forget to take it. It's not multiple times, just once a day. So you can choose to take it in the morning or in the evening.
I prefer night too when I'm back from my business and I want to sleep.
Okay.
So that it won't disturb my activities for the day.
Okay, ma. That's great.
When am I starting the drugs?
Okay.
I just want to be fine. I want to be okay. My children are still young.
I'll refer you to the treatment clinic where you'll be enrolled, and some other tests to be done to serve as baseline, and then they'll commence your medication almost immediately.
Dr. Ibrahim, there are other questions too.
I know you.
Dr. Ibrahim, can you hear me?
I can hear you, sir. I'm addressing.
You have spent close to 10 minutes.
No, you.
So, hello.
I'm addressing them, sir.
Okay. All right. So just try and.
Thank you. Thank you. I understand also that you are the fourth wife of your husband, so your husband has other wives, and the worry can be that what about the other wives and even your husband? The truth is, since you share the same partner, the risk of having this infection is there, but we may not be certain. The only other way to know is to test all the husband's wives, and also to check your other family members, like your children and those that stay with you. So I would ask that all your other family members and even your husband's wives and your husband himself, it's important for us to check.
They should do it. Who even knows whether it's from one of them that I even got it self? This polygamous life self.
This means that I may test positive also.
Yes, sir, there's that possibility because since your wife is positive, you have that risk.
Oh my
but
God.
We'll be sure until we check. And that's why it's important to test.
I just can't believe everything I'm hearing today. Just like a dream.
I'm really sorry about this, sir, but it's
Really
really
sad.
not a death sentence. Like I said earlier on, there are many people who have this, who are living with it, and they are living a near normal lives as long as they take their medication. And it is better to pick these things early, commence treatment, and then follow up as well. So I don't know if you have any other question.
So when can I have this test? I just want to know my status.
Yes, sir, you can have the test done almost immediately. I'll just request to the lab and send you there, if that's fine, sir.
It's okay then. Thank you, Doc.
Thank you very much, sir. And I don't know if there's any other question or comment, but I'd also like you to know that we'll be seeing you on other fixed appointments and follow up.
You said the drugs will start. When am I starting the drug? Am I getting them today or coming back?
You are starting them almost immediately, ma. You'll get them. I'll refer
Okay,
to the clinic where you other test samples will be taken and then you'll be commenced appropriately on the medications. Thank you, ma. Thank
Doctor,
you.
I hope these tests are not expensive.
Not expensive, sir.
Because
I
I said
believe
I'm going to include my other wives to have to do, and the children. You know, it's a lot of burden on the family.
yes, sir. I understand. When you check the fact that we need to be sure, and then, if possible, commence treatment. It's important to try to get.
It's okay then. I will see what I can do.
Thank you very much, sir. Thank you, ma, for.
okay, thank you, doctor. Yeah, I'm grateful.
So we'll see you during the next appointment, and to also check how you're doing on the drug, and to be sure you do not have any problems and taking them. Thank you, ma. So, ma, I don't know if you can just maybe say what we've discussed today, like in a way of summarizing everything we've done today. Thank you.
You said the test I did is HIV positive, and that I will have to be using drugs once a day at a time, regular time, and I will not stop using the drug for the rest of my life. That is important for me to use it regularly to avoid any other problem.
Okay. Thank you very much, ma.
All right,
About this, but thank you. So we
okay.
can in the next clinic. Thank you.
Yeah, thank you. Thank you, Dr. Ibrahim. And thank you, Dr. Light and Dr. Shamsuddin. Dr. Shitu, your hand is up, sir. Good morning, sir.
Good morning, Dr. Atal. Good morning, our presenters this morning. Well done.
Good morning, sir.
But, yes, but that is exactly how you should not cancel this type of patients. Our simulators, well done, but I know you're not trained actors. But I think all of us have canceled patients with communicable disease, particularly the viral ones that are sexually transmitted. Now, the key thing here is that the husband is there. Okay, and that means that the husband is going to be part of the council, because at that point in time, it's going to be difficult for the wife to say the husband should go away. Okay, but of course, you should still ask whether you want the husband there or not. But there's a good chance that the wife is going to say, no, leave him there, because she doesn't want issues when she gets home. Now, we've all canceled patients with retroviral disease. And we know that before you test anyone, you'll have had some pre-test counseling. Then you now have the post-test counseling that occurs after you have the results available. So it's important to first find out what the patient knows. Okay, it's important to know what the patient knows about the test that she did. Okay, of course, the patient will identify that, yes, I did the test, this is the test, they told me this, they told me why they're doing the test. So you have a background of the patient's perception of the results. Now, if they didn't explain everything, okay, the important thing here is to start discussing the possibilities of the test. So we would have said, okay, if it turns out positive, this is what happens, this is what is. Oh, don't worry about where you got it from, because this. Thank you, Lord. Also, if it turns out negative, you can also say, oh, if it turns out negative, it doesn't mean that you cannot contact it. You need to do this, you need to do that. So you basically have told the person what will happen regardless of the results. Okay? You'll have prepared their mind for all the possibilities. Okay? Before you then say, okay, this is the results. Okay? And when you're breaking the results, it's always good to point out that you have good news and not so good news. Okay? And ask the patient which one they want to hear first. Okay? If they say, okay, let me hear the good news first. The good news is that what you have can be managed and treated, okay? Which is the good news, okay? With minimum cost. So of course, the patient is happy with that. And even if they ask for the not so good news, the person will tell you, oh, okay, the not so good news is that the test results are out and I'm afraid they're negative. Now, because you have already explained to them the possibilities of the tests, and you've told them that, look, you may not be able to trace where you got it from because this is a polygamous home. Everybody has this stage. You've already told them that everybody has the possibility of transmitting to each other. You've also told them that there's also the possibility that we have to test everybody else and look at everybody else. You've already told them that. You told them the way you're going to have to sort out yourself if it's positive and all of that. They are ready for the blow. Do you understand? So when you do say it, you've already told them all the possibilities. So by the time you're telling them, oh, the test is positive, oh, they're already at ease because they don't feel so bad. The only thing is that they may want to have a few questions of regularity. They may start asking, oh, so how did she get it and things like that. And when you get to that point, oh, you just say, oh, like I said earlier, it may be difficult to trace it because it's a polygamous home. Okay, everybody, there are 5 different people in contact with each other, maybe not indirectly, and there may be a spread from one person to another and all of that. And of course, we know that it's not only sexual intercourse that transmits HIV. It could be sharing of sharps, it could be so many other things. People make their hair, they use needles. So you'll have disabused the fact that it has to be sexual intercourse. And then, of course, by the time you're breaking the bad news, the person, you soften the impact of the blow. Now, it's also important for us to look at the possibility that the husband may get little bit agitated and may want to start raising an issue early. Okay, and that's why I said the simulators were very nice. Now, because the simulators were not the agitated type, I'm sure some people here will still remember the one myself and late Dr. Williams did a while back that was really bloody. Okay. Once you make a wrong step, she was supposed to be the spouse that would scatter everything. So here, the husband may actually scatter everything and just start shouting, "Oh, my wife is an adulteress. I'm going to divorce her. I'm going to do this. I'm going to do that," and your counseling will just go south from there. Okay, your simulators were nice. Okay, ideally that husband should have baked. And if you think about it, I'm sure you've seen situations like that even in the centers where the husband or the wife just goes ballistic after hearing. So you have to soften that blow, okay, by already disabusing all these misconceptions, correcting any misinterpretations or anything, okay, before you give them the results, okay. There are situations where they even say both of them were tested and they are serodiscordant. In that case, you have to tell them all the possibilities. It's possible both of you are negative. It's possible both of you are positive. It's possible one of you is negative and the other one is positive. And you have to tell them all the possibilities that are allowed. That way, it softens the blow of what you're saying. Then, well, it was fine to actually find out the expectations and, of course, the concerns of the patients, okay, and all of that, very important. And of course, you did ask for a feedback, which is also important. You also try to arrange follow-up visits, which is also important. So I think the only thing that was majorly here was how you broke the news and then understanding the perception and being invited to discuss that thing based on what they know previously. Yeah, so those are the things I wanted to put forward. Yes, I hope we have time in the future to talk about this again with somebody else so that we can have a smoother transition through it and one that everybody can reference again. So thank you.
Yeah, thank you very much, sir. Thank you very much, sir, for your contribution. Dr. Ebiku, sir. Good morning, sir.
Yeah, thank you so much for the presentation, and thanks, Chief Shitu, for your always beautiful contributions. In fact, I thought my mind was like, "Kai, this woman is lucky. This her husband is so nice." Because if I was the one, in fact, I would have divorced her right there. How? Where did you get it from? It cannot be from me. God forbid. I'm not going to marry. In fact, just pack your load from here and go to your father's house. So, but that her husband was so nice, very gentle. So, and that goes to show that you don't break that kind of news like that. In fact, when I saw the question, I was wondering if the candidate is supposed to somehow find a way for the husband to actually give them some privacy initially. Then maybe subsequently, he can now be invited in again after the candidate has, decided with the patient on how to break the news to the husband. However, I realized that because of time, that might not be what is needed. So it required a lot of diplomacy because it's possible that the husband is negative. It's also possible that the wife actually got it from a boyfriend. But it's also possible that she got it from sharing of sharps, blah, blah, blah. It's also possible she got it from the husband. So there are a lot of possibilities here. And I was thinking that maybe they wanted to create a scenario of positive wife, negative husband, that's discordant spouses, or I think that's what they use for it, where the wife is positive and the husband is negative. So imagine that kind of scenario. Your wife gets a sexually transmitted infection and you don't have it. And then they are telling both of you at the same time, at the same place. For an African man, that one is a serious matter. Okay, so just as Chief Shitu said, there was a need to lay down the foundation, making everybody understand the possibilities. It could be positive, it could be negative. I'm yet to open it. However, remember we talked about this before you did the test, that it could be positive, it could be negative. Now, if it is negative, everybody's fine, there's no problem. It means that there's a clean bill of health. But if it's positive, there are many possibilities. It is possible that this, you got it from this, you got it from that, could be from your husband, you might need to test them and all that. Okay? But there's also a possibility that you got it from, maybe you shared shops with people, or maybe in the hair salon, stuff like that. However, there is treatment for it, even if it is positive. So by the time you lay all the foundation, then you now make a show of opening the thing in front of her. Okay, now I will open it. Oh, I've seen the result. Well, there's a good news, there's a bad news. And then you now go ahead. I think that's the way to go about it. Thank you for the beautiful one.
Hello, Chief Remy, sir.
I hope you heard me. Yes, ma'am. Yes, I can hear you, ma'am.
Actually, in this particular question, the husband was supposed to be excused.
Exactly.
Was supposed to be called back later. So the question had time. That was the right way of answering this question. She was supposed to deal with the wife. Once you're done dealing with the wife, you call in the husband, pretend as if nothing happened, just telling him that, that is if you got the right to discuss the result with your husband. If you didn't get the right, just say, I will need to test you, do some things, and please bring your wives, your other wives, so we can test them. We just want to clarify some things, make sure that all is well. You will just be, staffing around the surface. You won't give him the full gist because you've not gotten the right from the wife to inform him. So that was how they wanted the participant to answer the question. So I must commend to Ibrahim. It was a fair attempt, really. I wish our teachers didn't have to speak first because I wanted the participants to point out these errors. And I noticed a good number of them did. So that the participant point out the errors, then the teachers will now fine-tune some of those points. Because when Chief Remigus, Chief Chitu finished speaking, there's really not anybody who add. That's what I've noticed from experience. So, but the participant was a fair attempt. I love how calm he was, just that he didn't answer the question the way it should be answered. But I
I
love
think
the
he was calm because the simulators were nice. If
exactly
I happen,
simulation.
Exactly. The
if
simulators
I
were too
happen
nice.
to, if I happen to simulate this question, he will cry.
Actually, the exam, the simulator was this wasn't my exam, but I got from people that went for the exam. So I know told us actually what actually happened in the exam. And this exam was actually bloody then. That year was bloody. It was just 2 persons that passed or 3 persons that passed. So now the simulators were cold. Ma, do you want me to call your? Do you want me to say your husband, doctor, whatever you want? Ma, do you want to discuss your result? Whatever you want. Ma, are you okay? Whatever you want. They were not friendly. They were not this friendly. So anytime we play people to simulate for us, please don't be too nice. The exam guys don't usually that nice. In fact, the examiners will be checking their faces to be sure they are frowning, making sure their faces are blank, making sure they're not smiling, making sure they are as blank and unreadable as possible. And they used to make sure that they don't give you sign with their hands, their feet. So this is what the examiners do to make sure the examinators are as blank. You cannot read them, you cannot predict them to know if you're able to the right, if you're on the right track or not. So the exam, they're not usually that nice. I know these are your colleagues, you want to be nice, you want to be at just make it easy for them because we want to simulate the exam scenarios as much as
Sorry,
possible.
Dr. Christabel,
Yes, sir. No
sorry to
problem, sir.
interject. I wanted to just point out that if the issue was, if the way the exam was supposed to go, that was the way that you get rid of the husband, okay, or you excuse the husband, sorry, then you would need to first ask the woman that when you did your initial testing and the counseling before the testing, was your husband here? Now, if the husband was not there, then yes, you do have the impetus to say, okay, you should be excused. And I feel that's why the woman was just saying, do whatever you want, okay, because they're waiting for a prompt. Ideally, if the husband wasn't there doing the pre-test counseling, then he shouldn't be there for the post-test counseling, okay, unless the woman insists that he must be there, okay. So if you ask that question, oh, was he here when you were counseled before the test? If she says no, then you say, sir, okay, in that mind excusing us a bit while we discuss further, then we'll invite you in after we have discussed a bit, okay, so that the husband doesn't feel like they're trying to excuse the husband for you because you're hiding something or something. You just say that, oh, that is the regular protocol, that if you're not here for the pre-test, then you shouldn't be here for the post-test, but we will invite you in as soon as we have done that segment of the of this counseling. Okay, so that I think that's an easy way to excuse the husband, or find out if they want you to excuse the husband. Hello?
Thank you
Hello,
so
We can
much.
Dr.
hear
Christopher. Okay, all
Yeah,
right,
we
go
heard
ahead. All
we
right,
can hear you.
all right. That's what I
Okay,
just wanted to point out. Yeah.
okay, sir. Thank you, sir. One
Yeah,
more,
thank you,
one more
my
thing.
teachers.
Hello?
we can hear you. We can hear you.
Okay. One thing I wanted to just add before I hand over to Ata is anytime they give you any question in the exam, just ask yourself, what do you normally do? In real life situations, what do you normally do? I believe that will really guide you because most time they want to test your practice, your clinical practice, they go the ethics of practice and the rest. So most time that's what they test. So if this is what you should do normally wherever you are in the world, just know that pattern and you'll be fine. Irrespective of the patient's response, because sometimes the patients can be mischievous, just put you in an uncomfortable position to do something that is wrong. So please always do what is ethically correct. Dr. Atta,
Yes, ma'am.
Thank you very
Okay,
much, my teachers and colleagues. Thank you.
for all the contributions done so far. So from the chat box, Dr. Olalekan said, I think it's almost important to schedule another visit when the result of skin swab biopsy is available and the need for referral to a dermatologist. It's also important to investigate for any possible complications of HIV, for example, TB, considering the cough she also mentioned in her discussion. Dr. Ifoma said, would the husband have to be excused first? Okay, that has been answered. Should the husband have been excused? That too has been answered. Dr. Rukaya also, was question C addressed? How will patient's confidentiality be ensured while testing the other wives and family members? That's from Dr. Rukaya. That's her question. And she said it will have been reasonable to ask the husband if he knows his own HIV status. Not infrequently, patients with HIV go to another state in the country to get HIV care and hide it from their families. So those are the contribution. So was the question C addressed? How will patients' confidentiality be ensured while testing the other wives and family members? Dr. Ibrahim.
Thank you very much. I try to address that question in one, the major challenges, one, maintaining the confidentiality of the patient. So, but she's been unwell and she had come previously and had been tested. So I think that what to do is to, one, suggest to the husband who is there during this post-test counseling to speak to his other wives so that they just have the test done. At the same time, while doing that, I know it might not be straightforward or easy. We will not disclose the, because of the principle of confidentiality, we won't disclose the outcome of the result for the index patient, or would persuade for a check for everyone. And this will not be easy, but explaining to the husband who was in this counseling session and then getting him to just check everybody around the house is what will.
But Dr. Ibrahim,
Yes, sir.
let's look at this factually. If the husband goes home and tells his other wives that they should go to the hospital to get some tests done, the first question they'll ask is why. Okay. Aside that, okay, fine. Even if they don't ask why, when they get to the hospital and they start pre-test counseling for HIV, they're going to be wondering, why did they bring me to the hospital for a HIV test? Isn't that
Yes,
so?
sir. Yes, sir.
Yeah. So in that way, have you still maintained confidentiality?
It's sad. Sometimes these are some of the drawbacks with ethics, like real life situation like this, but it's a very difficult position, sir.
So that's what the question is. How are you going to tackle it? How are you going to be sure that you've upheld the patient's confidentiality to the highest level?
Yeah, sometimes you in terms of confidentiality and then autonomy, sometimes we override when we look at common good, the common good or the aspect of what would be the adverse effect if nothing is done, and in keeping maybe confidentiality or autonomy of a patient. There are sometimes in ethics where one may override that aspect because of the general good. So, sir, I think that this is very tough, it's difficult, but it might get to a point where the other spouses of the man would need to know, and then the importance of them testing to also know, because they have a shared risk, having the same partner. So that might not come in, sir.
Okay, so I think an easy way to get this done is that because you don't want the other wives to hound this particular wife, right?
Yes,
Because
sir.
they'll start making fun of her at home and all of that. Do you understand?
Yes, sir.
So an easy way to get it done is for the husband to go home and call all the 4 wives, okay? And say, oh, my doctor said I should bring everybody to do a test.
Okay, sir.
Do you understand? And
Yes,
all
sir.
4 of them are there, including the one that he knows already.
Yes,
Do
sir.
you understand? Yeah. And say, oh, we're going in for a test tomorrow. My doctor said we should bring everybody to get this test done because it's important that we all check it because we are a polygamous family or a family of with multiple partners. Okay, so we need to get this test done. That way, nobody looks at each other as guilty. So, but if you call just the 3 wives, the remaining 3 wives, and tell them, then they will start to suspect that the problem is the first wife. Do you understand?
Yes, sir.
So it's important to call all of them, like you call it small family meeting, and say we're going to the hospital together. They actually go together, get tested together, do everything together. Okay, they all get counseled together. So there's no suspicion that one person has a problem or the other person doesn't have a problem. Do you understand? That would be an easy way to get it done.
Thank you, sir.
All right. Well,
Thank you, sir.
Okay, thank you very much, sir, for your contribution, sir. Dr. Christian, start sharing your slide while I go through the messages. So if the ex-husband is excused out, Dr. Oji is saying if the husband is excused out in this session, should he be coming? Should he be tested first before asking the index positive wife to reveal her status to the husband? If the husband is excused out in this section, should he be tested first before asking the index positive wife to reveal her status to the husband? And then Dr. Rukaya also commented, Nigerian law gives full autonomy to protect confidentiality of HIV status to the patient such that the doctor can be liable if he gives information without the patient's consent, unless this has been changed recently. I think some countries like Singapore gave a timeline after which if the patient doesn't disclose to their sexual partners, then the hospital is mandated to do so. So those are the comments in the...
I think pertaining to that, please note that autonomy is not absolute. Okay? In situations where you put other people at risk or the community at large at risk, then you are compelled, okay, to reveal the information to the affected people. Or if it's in the case of a community problem, then you have to report to the authority. So in other words, the autonomy has been taken away from the patient, okay, because other people are at risk. Now, if you do keep it to yourself and you don't tell anybody else, then you create a problem because if that other person gets it and you as a doctor knew and you didn't compel the person to speak, then you are basically liable for that person getting it as well. Okay, so you compel the person to inform the others or to give the person a safe space to inform the affected parties, so that they too can also be informed of their status or assess their own status, and then of course take the necessary management that will be needed if it is positive, and then take the necessary protective steps if it is negative. So in situations where the community at large is at risk or an individual or other individuals are at risk, then autonomy, you actually compel the person to give up the autonomy. Okay. If the person still refuses, then you have to let the person know another person is at risk, and then you hand over to the hospital ethics committee for them to advise on what steps should be taken. Okay, but ideally you should not compel the person to inform the others. All right, thank you.
Yeah, thank you, sir. Dr. Dalhatu, you raise your hand. I don't know if you want to say. Can you just round up so that Dr. Christian can begin his presentation?
Okay, thank you, sir, for the opportunity, and thank you for the presentation. I just correct my
Your line is good.
Professor Hatu, can't hear you well.
Cannot hear you clearly.
Can you hear me?
Yeah, we can hear you now.
Hello.
Yeah, we can hear you now.
Okay, sorry. Okay. So thank you for the opportunity. So the Nigerian guideline, the reviewed version, now it gives a room for the healthcare worker to encourage the index patient to tell his or her partner or partners about the status. After some limited time, then he is empowered by the guideline to inform the partners that are at risk. However, the problem with that clause in the guideline, the time limit was not stated. Is it after 3 months? Is it after 6 months? So it still bounce back to the time limit has not been stated. And some of the stakeholders have informed the guideline reviews are subsequently a time limit should be put in the guideline. Thank you.
Yeah, thank you, Dr. Dalhatu, for your contribution, and thank you everyone for contributing to the last question. So, Dr. Christian, I know time is not our friend, but you try as much as possible to go as fast as you can. So you can comment now. Dr. Christian, we're not hearing you.
Okay, good morning, consultants, senior colleagues and colleagues. My name is Christian Wari Boko. So I'll be taking the WACP April 2023 OSCE recall, question 4A. So I hope you can hear me. 24-year-old male house officer in your hospital's emergency department with history of fever of 3 days duration with associated generalized body weakness. He took some antibiotics with non-relief of symptoms, so he decided to take anti-malaria medications. 2 days into acetaminophen, he developed cough and took amoxicillin clavulanic acid, still with no relief. 2 days later, he noticed headaches, sore throat, tingling sensation in ears, and a rash, making him present for management. Mention 4 other questions you would like to ask him, sorry. What is the most likely diagnosis? List 4 differential diagnosis. What is the vector of the disease? And what is the mode of transmission of the disease? F, how will you investigate the patient? G, how will you manage him? List 4 complications. What are the prognostic indices? So the first question, mention 4 other questions you would like to ask him. So I would like to ask the history of contact with someone with fever, history of contact with rats, history of contact with rats, feces, or urine, history of bleeding from any part of the body, history of hematuria, history of hematemesis, history of conjunctivitis or subconjunctival bleeding. What is the most likely diagnosis? That'll be Lassa fever. List 4 differential diagnosis. So for this patient, talk about resistant malaria because he already took acetaminophen combination, typhoid fever, leptospirosis, bacterial sepsis, bacterial meningitis, arboviral infections such as yellow fever, Zika virus, then anecdotal hepatitis, enterovirus infections such as the polio and Coxsackie viruses, infectious mononucleosis. Now, what is the vector of the disease? The vector of the disease is the multimammary tract, Mastomys natalensis. What is the mode of transmission of disease? So there are basically two modes of transmission, rodent to human transmission and then human to human transmission. So rodent to human transmission entails inhalation of the aerosolized virus, ingestion of food or materials contaminated by infected rodent excreta, catching and preparing mastocytosis as a food source. Then human to human transmission, direct contact with blood, tissues, secretions or excretions of infected humans, needle stick or cut, inhalation of aerosolized virus. Now, how will you investigate the patient? So you can do the reverse transcriptase PCR for the viral protein, can do a lassa, do a viral culture. However, this this has to be done in a high containment lab, usually not environment available in an environment. Full blood, others are full blood count, electrolyte and creatinine, liver function test, and now how will you manage the patient? You have to admit the patient to at least a high dependency unit. Barrier nursing, management should be multidisciplinary management involving the infectious disease physicians, the intensivists, laboratory scientists, nurses, and pharmacists. The management basically general and then supportive management. Most of it is about fluid and electrolyte support. They give antibiotics for fever. I want to do, of course, depending on the state of the patient, you want to do ABC of resuscitation, so the airway breathing and oxygen. You want to monitor arterial blood gases. So you want to do, of course, you must have done arterial blood gases earlier. You want to monitor input and output. It's a place for antibiotics for secondary bacterial infection. And then the antiviral medications, ibuprofen have been found to be useful, especially when it's given early within the first 3 days of the illness. Others are infectious control, appropriate PPE for staff and all members of staff, so as to avoid a hospital epidemic. So infectious control is very, very important so that there's no spread to other members of staff. Of course, you now report to appropriate authorities. Now, list for complications. Complications include renal failure, like liver failure, deafness. I've seen in this patient already has, okay, not really, already has some hearing tremors, encephalitis, pregnancy miscarriages. Then what are the prognostic indices? Prognostic indices go to high viremia, serum AST level greater than 150 international unit per liter. If there is high viremia is a poor prognostic. If the serum AST level is greater than 150 international unit per liter, poor prognostic connotation. If there is bleeding, there's encephalitis, there's edema, and then even in third trimester of pregnancy, these are all poor, this all convey poor prognostic indices for the patient. Now, I will now go ahead to give a brief overview of Lassa fever using this outline. Now, by way of introduction, Lassa fever is an acute illness caused by the Lassa virus. It's a single-stranded RNA hemorrhagic fever virus in the family of Arenaviridae. It was discovered in 1969 in Lassa, a town in the northeastern part of present Borno State, Nigeria, following a nurse, a volunteer nurse, taking care of obstetric patients, falling ill while taking care of this patient, and later die in this town. It's endemic in areas of West Africa, including Nigeria, Liberia, Sierra Leone, and Guinea. In Nigeria, cases there are cases all year. However, the peak is seen during the dry season. Now, transmission, just like I've described this, as this was part of the stem. So basically, rodent to human and human to human. I think I've already discussed that. So just move faster. Then, by way of pathogenesis, now the virus has this predilection for the endothelial cells. So there's endothelial the virus invades the endothelial cells, and within the cells, it replicates intracellularly using an L polymerase enzyme and a nucleocapsid protein, which synthesizes the viral ribonucleoprotein that produces the messenger ribonucleic acid and antigenomic RNA required for transcription of the viral proteins. Now, the nuclear protein also helps the virus to evade the host immunity, also help the virus to prevent it being destroyed by the host immune system. Now, following all these, what happens at the there's endothelial cell damage, and then capillary leak, leading to the clinical features that we see. There's also platelet dysfunction. There's also virtually all organs are involved, are affected, all organs, so including the heart and more so the liver. But there's also cytokines and other cell mediators of shock and inflammation are also released. Oh, so sorry about this. This is quite small. So the clinical period, the incubation period is 5 to 21 days. It's a guy with a gradual onset fever, headache, malaise, like we saw in this patient, and other non-specific signs and symptoms. There is pharyngitis that we saw in our index patient, myalgia, retrosternal pain, cough, and gastrointestinal symptoms. Then the minority of cases present with symptoms of bleeding, neck and facial swelling, and shock, which when seen, they are actually poor prognostic indices. The case fatality of among those who may not need hospitalization is about 10%, whereas among people who are hospitalized, it rises about 15 to 20%. And this rises further in pregnancy, for the pregnant women, and for up to like 30%. While for the unborn child, the fatality rises to as much as 80% for the unborn child. So it's particularly severe impairment, just like I've already said. Deafness is a common sequelae and is seen in some about 25 to 35% of patients. Now, differential diagnosis, just like I've already answered this in the question, so it's not available. There's no need to waste our time. I've already discussed all this. So investigations, as already discussed when I was answering the questions. Treatment, I already discussed. Prognostic factors, we already done that. So you just go ahead for prevention. So it's to avoid contact with rats and their droppings, put food away in rodent-proof containers, keep our homes clean, so that we don't encourage the rodents to come and look for these food droppings and thereby come in contact with humans. You wash hands regularly, and then you observe universal precautions. Conclusion: Lassa fever is endemic in Nigeria. High index of suspicion is required as to make prompt diagnosis and early treatment. Very important, like I said. The outcome is better especially when you diagnose made early and treatment commenced early. As we know, the antiviral agent ribavirin is particularly effective when it started within the first 3 days. So hence the need for high index of suspicion to make diagnosis earlier. Prevention is key. Thank you so much for listening to me. These are some of the references. Thank you.
Yeah.
Thank you.
Thank you, Dr. Christel, for a lucid presentation. Any contributions, any comments? Any comments, any contributions? Our time is fast spent. Okay, Dr. Tanimu.
Thank you very much for this presentation, and you have done very well. My contribution is that among the complications, the most important one among them is kidney innephropathy, and that is why sometimes you even have dialysis machine on the Lassa fever complex. isolation center. So nephropathy is among the most common complication and the poor prognostic factor for mortality. Thank you very much.
Thank you, Dr. Tanimu.
Thank you, Dr. Tanimu. Any other contributions? Dr. Edwards said, please, can you add treatment regimen to the slides and options in pregnancy?
Okay, okay, I'll do that slide.
Okay. So, Dr. Christabel, can I hand over? Seems there's no other contribution.
Okay.
Dr. Good to identify. Dr. Fee said it is good to identify and treat comorbidities, and then contact tracing also.
I'll be added in the manuscript.
Over to you.
Okay. Thank you, Dr. Christian. Thank you for the lucid presentation. Thank you, Dr. Atta, for coordinating and the participants. So thank you for your participation. I appreciate you all. I don't know. The first speaker, thank you so much. Thank you. That was a fair attempt at the question. It's been a wonderful day. Please, we still close the class by 7:05. So please, I know sometimes, most time we're lenient, but we're trying to be firm so that we encourage to start early and close early. I don't know if any of our teachers, let me quickly do something.